Thank you very much. Thank you very much. Amazing show. I'm not sure this is the best moment to to do a lecture, but thank you very much to the Dr. Selva and the organizing committee for inviting me to this conference. And of course, thank you very much to APAGE and ISMIVS. And of course, thank you very much to Chongqing University, okay, for inviting me to the international workshop on HIFU tomorrow, okay? Right. The first is very important for me in this presentation, because I have been asked to speak about our experience in treating uterine fibroids with HIFU, okay, and pregnancy outcomes. And the first thing I want to say is, you know, uterine fibroids are very prevalent and cause significant morbidity in women, okay? And of course, there is enough evidence about their negative impact on fertility, being the sole cause of infertility in 1 to 3% of women and causing 7% of recurrent miscarriage, okay? It's a serious problem. In addition, I must also take into account the age factor, okay? Modern societies have changed rapidly, and currently, there is a tendency to delay childbearing beyond the age of 32, mainly in Western countries, of course. And this situation, combined with the increase of fibroids with age, leads us to a new scenario, which is the large number of older patients with uterine fibroids and problems conceiving, okay? Unfortunately, the advances in reproductive technologies cannot compensate for this issue. And this is a serious problem. Right now, focusing on fibroids, there is a consensus that submucosal fibroids of any size and intramural fibroids distorting the uterine cavity have the most significant negative impact on fertility. On the other hand, some authors support the idea that intramural fibroids greater than 2 or greater than 4 centimeters, depending on the studies, even without cavity distortion, may also impair fertility. And that's because there are other mechanisms apart from the anatomic distortion that could lead to infertility, as the increased uterine contractility, the impairment of endometrial and myometrial blood supply, and hormonal changes induced by fibroids, which could impair gamete transport. Different problems of these fibroids can you see? Okay, all of them, these problems, all of them explain the infertility of women with small non-cavity intramural fibroids. In this line, some publications conclude that this type of fibroids, even small size, 2 centimeters, for example, really impact adversely on HIFU outcomes. However, it also concludes that there is still no definite evidence to indicate routine myomectomy in these cases. We strongly believe that HIFU therapy, but its non-invasive nature, could also be a good treatment option for these patients. Okay, what is HIFU? You know, what does it work, and what can it offer our patients? The therapeutic principles are the following. High-intensity ultrasound waves are delivered by the HIFU transducer. They travel safely through adjacent tissues to arrive and focus onto the focal spot, okay, the focal point inside the body. And suddenly a small area of selected tissue is heated between 70 to 100 degrees, resulting in a coagulative necrosis. As you can see in the images, focal point is guided by real-time ultrasound, okay, in this case, in this technique. Okay, but what are the main advantages of this technique? What makes it so different from other therapies, from surgery, for example, principally? The first thing, there is never bleeding or infection. Typically complications of conventional surgery, not in this case. There is only mild postoperative pain. The procedure is done under conscious sedation. All patients are discharged between 3 and 5 hours after treatment in our hospital. 100% of patients are outpatient procedures, and patients have a faster recovery after HIFU compared to surgery, of course. And very importantly, no skin or uterine scars, which is of a special interest in women with gestational desire. And that's because HIFU achieves ablation of uterine fibroids without damaging the surrounding myometrium, okay? There is conservation of the myometrical properties of the myometrium, biomechanical properties of the myometrium are preserved. HIFU also preserves ovarian and endometrial function. We have some studies that show no significant difference between the anti-Mullerian hormone levels before and after treatment. And in this other prospective study on the right from 2020, Melkozerova et al. Observed no significant changes in molecular and tissue markers of endometrial receptivity, okay? No differences in women undergoing HIFU ablation for uterine fibroids. Okay, for me, this simple slide is very, very, very important, okay? In my opinion, the objectives of HIFU ablation of uterine fibroids in women with gestational desire are both. On the one hand, to achieve the inactivation of the hormonal and vascular function of fibroids, which will be achieved immediately on the same day of the treatment on the same day of the HIFU treatment, thanks to the total necrosis of the fibroid. Okay, this is the first goal. And the second goal, the second objective of this technique is to shrink the fibroid, treated in order to normalize the uterine cavity, the uterine anatomy, especially important in submucosal fibroids, of course. But both things seek to increase the chances of obtaining a safe pregnancy without the complications of surgery, okay? Logically, the greater the ablation of the fibroid, the greater its shrinkage during follow-up. We already have several publications with good pregnancy outcomes after HIFU treatment, large series with high gestation rates, obtaining full-term pregnancies with normal delivery, and of course without complications. No cases of uterine rupture or abnormal placentation in all of these publications. Okay, our experience is not so much different from all these publications. In our retrospective study, we include 560 women with symptomatic uterine fibroids who underwent ultrasound-guided HIFU between 2008 and 2018. 71 pregnancies of 55 patients have been obtained, which is, to our knowledge, the longest series of pregnancies after HIFU treatment in a Western country. The pregnancy rate was 34%, which is not bad if we compare it with other treatments. Among the 71 pregnancies, there were 43 successful deliveries, including a natural twin gestation, with an incidence of cesarean section very low of 43%, which was much lower than in patients undergoing myomectomy or uterine artery embolization, or in those reported by other authors after ultrasound-guided HIFU. Okay, in relation to the 55 women who became pregnant, more than a half, 55%, I can point, 55% were at least 36 years old at the time of treatment. 80% were nulliparous women, okay? And we must highlight that 33% had primary or secondary sterility, and 18% had at least one miscarriage before HIFU treatment. Okay, the rate of preterm delivery was 9%, only 4 cases, which is lower than in series of pregnancies with untreated fibroids, or pregnancies following uterine artery embolization. The mean birth weight of the 44 newborns was 3 kilograms. 7 of them were low birth weight infants, this that you see here, okay? And except for the 1.4 kilogram baby who was born with a previously diagnosed tetralogy of Fallot and intrauterine growth restriction, the remaining newborns, 98%, developed well without complications during postpartum and breastfeeding. Okay, these are the complications detected during pregnancy. 1 preterm labor, 2 cases of placenta previa, and 2 cases of preterm premature rupture of membranes, okay? And during delivery, 2 cases of emergency cesarean section. in one case for fetal bradycardia and the other for hemorrhage associated with placenta previa, and 3 cases of retained placenta with manual removal, and finally 1 case of severe preeclampsia. Okay, not so much complications. And the results were achieved in women with a medium maximum diameter of treated fibroid of 6.4 centimeters and a non-perfused volume ratio of 76%, which is higher than that reported in most series of HIFU treatment, okay? 6.4 centimeters in these patients. And these are some of the cases we have treated. We can treat with HIFU different fibroids of different locations, is not problem. At the beginning, for example, submucosal fibroids, pedunculated submucosal fibroids were contraindicated for this technique, but now we are treating all the locations in these cases. For example, this FIGO type 0, the fibroid is occupied the whole cavity, okay? And here we have the completely abrasion. This is a magnetic resonance image after treatment, and 6 months later, the fibroid completely disappear, and 2 months after this MRI, this control MRI, okay, with good pregnancy results. 2 pregnancies, spontaneous pregnancies, with no problems in the perinatal moment. Okay. This is a transmural, it's a FIGO type 2-4 fibroid, very big fibroid, 10 centimeters. Okay, this fibroid was successfully treated with HIFU and with hysteroscopic resection of the remaining myoma fragment. Here, 6 months later, this is 6 months later, okay, and after we do the hysteroscopic resection, and this is a hysteroscopic diagnosis, hysteroscopic with a completely normal cavity. And okay, 3 months later, we have the spontaneous pregnancies with a vaginal delivery, 3 kilograms baby, no problem. And okay, cases of polymyomatosis here, a big fibroid, okay, another fibroid of 5 centimeters, submucosal fibroid. And the submucosal fibroid that you see here disappeared completely 8 months after HIFU. And just at that moment, when the fibroid disappeared, the patient underwent a successful in vitro fertilization and got a full-term pregnancy, okay? Okay, as a conclusion, so take-home messages. Uterine fibroids can negatively affect fertility and increase the risk of specific pregnancy complications. There are some advantages, okay, that we have considered. And according to our experience, this technique is effective and safe to treat uterine fibroids. Patients undergoing ultrasound-guided HIFU treatment can achieve full-term pregnancies with no complications or few complications. And okay, due to its non-invasive nature, okay, probably is the first option in women with uterine fibroids and gestational desire with many advantages, okay? In some cases, HIFU could even improve the fertility, okay, we have to demonstrate it, of patients with a history of primary or secondary infertility. In our series, 30% with this history, okay? But we need prospective randomized studies to confirm these observations. Thank you very much for your attention.
Thanks, Prof. Jordi, for a wonderful lecture. Any questions from the floor? I think there was a good series. Yeah, there's a question there.
Professor Jordi, yes, I would just want, Dr. Hon from Hong Kong, I just want to ask for the spontaneous pregnancy after HIFU, is it you should let it after 3 months or 6 months, or is it or you ask them not to be pregnant immediately after HIFU?
Okay, it depends on the type of fibroid, okay, the fibroid, okay. For example, in submucosal fibroids, of course, we need a normal cavity, completely normal cavity, uterine cavity, okay? And perhaps, for example, in a fibroid of fibroid FIGO 0, sometimes we treat as this case, but FIGO 1, FIGO 2, a fibroid of 2-3 centimeters, probably in 3 months or 6 months, we have a normal cavity. In this moment, we recommend to try to get pregnant, okay? For example, in intramural fibroids, FIGO type 3, FIGO type 4, for me, it's not necessary to wait so many times. Why? Uterine cavity is normal in FIGO 3, FIGO 4, okay? And we have ablated, we have done ablation of the fibroid, okay? But we don't need to shrink the fibroid in this case, in intramural fibroids. It's my opinion, I cannot demonstrate, but probably in intramural fibroids, it's not necessary wait so much time. Probably in fibroids of 3, 4, 5 centimeters, not waiting time. In fibroids, 6, 7, 8 centimeters with normal cavity, probably it's better to wait a waiting time of 3 months, 6 months to shrink the fibroid in bigger fibroids, okay?
So for the submucosal fibroid, do you, you say you do the hysteroscopy to demonstrate a normal cavity for submucosal fibroid after HIFU. You see as a normal cavity and then you tell the patient, or you can try pregnant. How about instead of diagnostic hysteroscopy, we use the saline sonogram? Put in saline and or see is it possible to demonstrate as a normal cavity?
Yes, it's possible to do a hysteroscopic diagnosis, hysteroscopic to demonstrate normal cavity, but I think with the ultrasound is enough to demonstrate a normal cavity. We have 2D and 3D ultrasound. Okay, for me is enough. In difficult cases, or sometimes in FIGO type 3, near to the cavity, if the ultrasound is not enough, you can do a hysteroscopic to demonstrate.
Thank you, Prof. Jordi. I'm Indra from Indonesia. I want to ask you, did you give any medication after the patient success the HIFU? I mean, some of us give anti-GnRH analog to reduce the recurrency. What about your opinion? Thank you.
I don't give any treatment for the moment. If the treatment has been success, no medication after HIFU. Only the HIFU ablation and shrinkage of the fibroid in 3-6 months. Okay, no. Perhaps in some cases with only a non-perfused volume of, for example, 80% or 60%, or yes, partial results. No, in these cases, probably it's important to give GnRH analogs. Okay, but in cases, very good cases, non-perfusion volume of 100%, 80%. Okay, waiting time and 3 months, 6 months. And
okay, thank you very much.
Okay, Prof. Jordi, there's an online question here. How about outcome of HIFU in adenomyosis with infertility?
Sorry, can you repeat slowly?
Okay, how about outcome of HIFU in adenomyosis with infertility?
Okay, I think Dr. Selva in the in the next presentation will explain you. But okay, I
tell them I'll answer.
I have experience, but I think not so much experience as Dr.
Okay,
Selva, but I can answer the question. Okay, but it's a different tissue. Adenomyosis is a very different tissue than fibroids. Okay, it's very high vascularized tissue, and sometimes it's necessary to sonicate with high intensity in different points of the adenomyosis, carefully with the endometrium, carefully with the serosa. But okay, yes, we can treat adenomyosis, focal and diffuse adenomyosis to improve symptoms very challenge this pathology. Okay, it's very difficult.
This is it.
Yeah.
Yes,
Is
I-
there a possible-
Okay, there's still some online question is there. Is there a prospective randomized trial underway at Madura Teresa Hospital?
Sorry, is there any?
A prospective randomized trial.
No, in this case,
Okay.
no, I don't have.
Okay,
Prospective randomized study.
okay. There's one more
In the
here.
future.
In doing HIFU on a submucosal fibroid in a patient with infertility, will it not cause damage on the endometrium and thereby affecting the long run, in the long run, the chances of pregnancy?
It's a good question. Okay. We in all the cases we have done, we don't have any case of amenorrhea, for example. No cases of amenorrhea, never. All the patients have menstruation 1 month later. Okay. But I cannot demonstrate. There are some studies about the endometrial receptivity with no alterations. Okay. But I don't have studies to conclude. It's impossible to have a lesion in the endometrium. But for the moment, patients of 20 years, 40 years, no problem with endometrium, never. I mean, no amenorrheas, okay, no heavy menstrual bleeding after HIFU or problems related to the close to the endometrium. I think there are some.
Okay, there are some more questions.
Thank you very much for your presentation,
You're
Dr.
welcome.
Wasuna from Kenya. What's your experience with parasitic, if any, or pedunculated myomas? Thank you.
Particulated or
Parasitic.
parasitic? Yeah, no, parasitic, no. No, but with pedunculated, I have some cases of pedunculated fibroids, okay? And tomorrow I will explain some cases about this one in the workshop. But okay, it's more difficult to ablate these cases because are technically a little more difficult, but it's possible to treat. That's because the pedunculated fibroids are involved. Yeah, yes, there is no adjacent tissue. Not a myometrium, it's bowels, bowel around the, and okay, carefully in these cases, okay? And in so many cases, we have to compress the abdominal wall during treatment, and this compression mobilize the fibroid, yes, and sometimes, okay, it's difficult, yes, to maintain the same point ever and ever. But finally, we have very good results with, okay, in pedunculated fibroids. Submucosal pedunculated and subserosal pedunculated, both cases, yeah.
Just as a follow-up, for that kind of a fibroid, seeing that, as you say, there's bowel around, have you had to adjust the amount of intensity just to be safer? Or what do you do in terms of safety for one of those pedunculated fibroids with gut around it?
Okay, sorry, you're asking about what? Surgery?
So, no. So when you're doing HIFU on a pedunculated fibroid, and perhaps there is intestines around, gut around it, have you had to adjust the amount of intensity of just to be safe?
Yeah, no, yes, probably we adjust the intensity, but the intensity is adjusted depending on the grayscale changes. No, because if finally you have the focal point perfect visible, you have a very good view of the fibroid. Okay, we can treat with a 1 centimeter from the serosa. Okay, no problem. The power is adjusted depending on the grayscale changes and other factors, but not, yeah.
Thank you, Prof. Jordi, for the lecture. I am Dr. Yan from Indonesia. I have a question, Prof. The first one, how you measure the fibroid by 2-dimensional ultrasound or by 3-dimensional ultrasound? And my second question is, what is actually the decreased target size of the fibroid? The shrinkage, Prof, 70% or 80%, what is the cutoff until we can let the patient get pregnant spontaneously or by the ART? Thank you, Prof.
The second question is similar to the I asked before, because it's not cutage, it is not exactly percentage of the shrinkage. Not. If it depends of the cavity distortion or not cavity distortion, and at the beginning the fibroid, how much is it? Okay, for example, the same question in the, for example, 7 centimeters fibroid, we can wait, okay, probably 3-6 months to get pregnant, okay, patients, but it's not a cutoff, no, in this case, no. It's normal cavity, okay, so principle, the uterine normal cavity. And the first question is about the 3D and 2D ultrasound. The measure.
Yeah, you measure the 2-dimensional or the volume of the myoma.
Yeah, we do a ultrasound follow-up every 3 months, 3, 6, 12 months, and annually to calculate the volume of the fibroid in 2D. Yeah, not 3D for the moment. Okay, in 2D. After treatment, of course we do a MRI with contrast. Okay, to evaluate the non-perfused volume. But 3, 6, and 12 months with ultrasound, 2D ultrasound, yeah.